I think at the end of the day, the relationship game is one of the biggest pieces that you can have is, being trustworthy and showing that trust and earning the trust of people. And that does not come right away.
Hello, everyone. This is Cole from the American Journal of Healthcare Strategy, joined by a really special guest today, Crystal of MUSC, Crystal Broj. Crystal, please introduce yourself and your current role.
Thanks for having me, first of all, and Happy New Year. It's good to talk to you again. I'm Crystal Broj. I am the Chief Digital Transformation Officer here at the Medical University of South Carolina, based in Charleston. It's a very new role. We've only had a digital transformation office for a little over 2 years. Started the role 2 years ago with just a team of me, but we've grown it to a team of 10 now who are doing some really amazing things. And I think we're going to talk a little bit about that today.
Thank you so much again for coming on. People think of the South and South Carolina. They kind of think of it as like a slower, not as technologically advanced region. I'm from Raleigh, and I've had a lot of friends who are going to MUSC, whether for school or for fellowship. And I've been hearing from them, I've been hearing on the news that it's actually doing a lot more innovative things than what at least I've seen even up in the north, which is what people assume is the innovative area. And so I was excited to bring you on board to the podcast and really discuss and showcase the high level of innovation that's going on there. And like you said, it's a new team, and now you said there was 10 team members now.
Yeah, we have 10 team members, including we have a fellow and 3 interns. So definitely into that, teaching innovation to the, younger generations who are coming up through digital health and getting them involved early, which is amazing that we have those programs. Our innovation district that's coming that you'll keep hearing more and more about at MUSC, we're really building out to be a tech hub to do really cool things with combining technology and healthcare. So keep a lookout for that too. But we have been doing some really great things in the past 2 years with digital things. Do you want me to just start on one or two? Where would you like to start?
Yeah, no, I think I would really love to hear also for people who do not know, what does the scale of MUSC look like? How many kind of hospitals and what does that look like?
So we are we're just celebrating our 200-year anniversary.
Wow.
We just had our anniversary dinner last week. So we're one of the oldest medical colleges in the South. The only comprehensive academic health center in South Carolina. 2.4 million patients served annually. 16 hospitals across the state, 2,700 beds, 750 locations. We serve every county, all 46 of them in the state of South Carolina. We are one of 2 national telehealth centers of excellence in the country, one of 2. We have a little over 3,000 students, 22 faculty and physicians, 6 colleges in the medical university side, 42 degree programs, about 5.9 billion total enterprise operating budget, and a 10 billion estimated economic impact to the state of South Carolina. So while we might be looked at as small down south, we have big numbers. We're also awesome with clinical trials. We get a very large amount of research funding, about 300 million. We have almost 1,200 clinical trials going on at once down here. So
Wow.
all over the place, lots of really, really, really cool things. 55 active faculty startups, 33 products in the market, 595 international and U.S. patents. So lots and lots of innovative thinking and processes here in South Carolina.
And you originally got a degree in computer science, right? Way back. So has that helped you to be innovative? Because I guess one of the things I'm wondering is how do you find yourself in a role where you're overseeing the organization that's essentially responsible for medical innovation throughout the whole state?
So yeah, I was a programmer back in the day when I first graduated college. So I think that helps me because having that IT background lets me bridge the gap. And my sweet spot for personally, what I love is taking business problems and finding technical solutions. And as I grew up in my career, so to speak, I went from programming to business analyst to managing to directing those types of things, not just in, and I started healthcare much later. I've only been in healthcare for about 5 years, but in manufacturing and financial and insurance, and solving those kinds of problems and bringing technical solutions to them. So learning healthcare from the outside in has been very interesting. It also allows me to bring some new ideas to the forefront and new ways of doing work, so it's not the same old. And MUSC really embraces that, and I have really good support from leadership, which is amazing.
Yeah, that leadership support is a key thing, and I think some of the projects that you've talked about working on as well, when the audience hears about them, really require that support from enterprise. And so, yeah, please share what are some of the innovative things you're working on? I know we discussed a couple of them last time, and I'm really excited to go a bit more in depth.
Yeah, we have some really good projects and good outcomes with them now. We started with robotic process automation, which is, if you think about AI, this is sort of the easy part of AI. It's just literally having bots do work that people do. So we started with a very small project to start with. We wanted to outreach to our patients when they have an appointment and say, "Hey, Cole, you have an appointment in 3 days. Would you like to confirm it or cancel it? I need some demographic information," stuff that you used to put on the clipboard, the awful clipboard that you get at the front desk, right? So now we can collect that. We collect it on your phone. You put in all that information, and then it goes automatically into our electronic health record, which for us is Epic. And it's very seamless. It can, take a picture of your insurance, take a picture of your driver's license. All of that goes over. And so we started a pilot with our partner Notable, who we use for that, and we did it for 5 sites. As we talked about, we have 700 plus sites across the state. Started with 5 sites just to start to work with it, and then we rolled out to some more sites, and then we rolled out to some more sites, and we added new features along the way, because one of the things that we did was we captured, how's this experience for you? Thumbs up, thumbs down, and then a whole, comment section. And very amazingly, a lot of people gave us a lot of comments. 98% patient satisfaction with the experience, which I think is amazing. But even so, they'd be like, "This is great, but I have 3 appointments in 1 week and I'm getting 3 emails or texts from you. That's a lot. That's a lot to have to do. Why can't I just check in at once?" Why can't they check in at once? We looked at it, we changed it. So now if you have more than one appointment in a week, you get it on Sunday and you're checked in for all your appointments during the week. We'd really like to have it in Spanish. We put it in Spanish. We got all kinds of comments from our Spanish speakers here in South Carolina, which is the second language in South Carolina, by the way. And they love it. They love to be able to do it. They love being able to do it at home or when they're on the go and not have to sit in a doctor's office and be filling out all those forms. The other thing we do is, well, we filled this out before. Why do I have to do it again? Well, we pull the information that's in Epic so you can just validate it, where you can't do that on a clipboard. And, the people at the front desk are not going to print it out and go, "Show me, make sure this is all correct," right? So we're able to do that. But we did have some bumps in the road because, being iterative and changing things along the way, occasionally things didn't work right at the beginning. And so some of those early offices were like, "Oh, that doesn't work." Or somebody would come in and go, what is this thing that came to me? Is this real? And they'd be like, "Yeah, no, just come and see me, Susie, at the desk, and I'll give you the clipboard, and
Right.
then you can fill it out." And so then we found that our front desk people were telling people not to use the software, which is kind of not what we were hoping for. So we did some training on that, and then we know too that front desk people turn over, right? And so then the new person didn't know what this Notable thing was, and so they kind of ignored it. And so we had to put together, do a lot of change management, put together training programs. So every time somebody gets on board, they learn what Notable is so they understand. But we've gotten some really, really good numbers out of this too. We now, at time of service, get copay collections. They're up almost 20% from before we had this. Our no-show rates are down almost 4%, which is great because we also use Epic FastPass. So if you cancel your appointment for Wednesday and I'm on the waiting list, it'll automatically notify me and say, "Hey, do you want to take Cole's appointment at 10 o'clock?" And then I get in and get my service done faster. But the biggest change was that our pre-visit check-ins went up almost 67%. So people really were using the software to get that along. So very excited. We handle about 100,000 monthly digital registrations. And for the front desk people, it saves 3 to 5 minutes.
Wow.
So if you average that over all of our front desks, we're saving about 500 hours a month, which is amazing. Now, that does not mean that we let Sally go on Fridays because we need those people still at the front desk. But instead, that lets Sally actually be able to look up and go, "Hello, Cole. How are you today?
Right.
or be able to, when you get out of the office, schedule a referral or your next appointment or whatever right there, and really focus on taking care of what we think is most important, which is the patient.
Yeah, that is, and like I appreciate you giving us the scale because people, they'll say, okay, 60%, 4%, et cetera. But when you're looking at a system that serves millions of people, I know at Jefferson we have about 4.8 million outpatient, 4% of that's 200,000 appointments. So I mean, that's a big deal, right? Being able to gain 200,000 appointments back a year by reducing no-show rate by only 4%, that pre-check-in is so important. Again, I want to talk about that referral process real quick because I think that's like a big hidden value is when they get that time back, you're now doing inline referrals. They're going to be referring usually within the organization. That's going to allow them to, I'm assuming, check in again on Epic when they get that referral to a new appointment. And so it just creates a continuity of care that we've been working on for a while.
Yeah, and the other thing too is that we really needed to build trust in the system. So once we knew we could do RPA with this, now we've added on. And so this year our big thing is part of that referral process, starting with prior authorizations. Right now, you get it on Epic. You have to type it into the payer portal and then wait for the referral code and then type it back into Epic. That can take anywhere from 15 to 30 minutes per authorization. So if you need an MRI, somebody's actually doing your lookup to make sure insurance will cover it. Now using bots, going from 30 minutes to about a minute. It'll
Wow.
automatically know. And nobody has to type. And so then they're processing the ones that get denied, or they're doing that kind of stuff. So that happens a lot faster, which means that you can get in to get your MRI faster. You can get treated faster. So we're working on that right now. Again, it's a bot training thing. About 40% are actually going through right now, not being touched by a human, which is amazing. And so we're continuing to scale that. And now we're looking at working on referrals because if we're in a health system and referrals are phone calls, but they're also faxes, believe it or not. And one department will fax to another department, and then it goes to the patient access center, and then somebody has to type it into Epic, and then it goes into queue, and then somebody calls and says, Cole, do you want to schedule your appointment? And so we're trying to automate some of that process too. So again, we can serve the patient quicker and get them the care that they need.
How did you, or I guess the probably better question is, how long was the process of getting that executive buy-in from when kind of the team was founded to where they're letting you or encouraging you to take up bigger and bigger projects, right? Because I know from a CFO perspective, innovation can be kind of scary in some ways because a lot of CFOs have said it's like putting money into a black box where you give money to an innovation team and you have no idea what they're doing with it.
Yeah, I'm really lucky because innovation is one of the key things that we lead with. And our CEO is very, very supportive of this work. So when I came in, we had just started with this notable project. They were just getting ready to launch the five. And they sort of, let me take and lead it and then, build it up over time and make sure that it was successful and spend the time and care that it needs. Because a project like that, you can't just expect a vendor to do it, plug it in, and it be done. All that change management, the training, the support, the making sure that that's working is something that's very, very important to make these types of projects in digital successful. And being able to show success there then allows you to go, okay, yes, let's do this now. I started while I was doing that, putting together a whole digital roadmap of the types of things we wanted to do. And so I started in October. Our roadmap was done by talking to stakeholders. What do you need? How can we help you? That kind of stuff. Our roadmap was done in about June. And so then I had this beautiful plan of the work we were going to do over the next 3 years. And then that in November, ChatGPT became crazy busy. And all of a sudden it was the buzzword. By December, somebody's like, hey, let's look at ambient technology for scribes. And so that just like my scale of a plan went off the wall, right? Because now it's like, okay, we're going to move this out. We're going to move this out. So we have time to do this. And we partnered with our solutions team to bring in actually the ambient scribe. And that is, we're using Nuance DAX. And so we started with a pilot. We started with just a couple of providers to start with. And then we grew the pilot and we decided we were going to do it for a whole year. So we really, really knew what was going to what we were going to work on and if it was going to work for our providers. And we found out a lot of things. We thought patients might not like it. We thought patients would be very adverse to having that in room. And the opposite from our surveys and things, patients actually love it. They were really excited with the experience because instead of having to type into Epic the whole time, which by the way, no provider ever went to school to become a doctor, a nurse, or whatever, and said, I can't wait to type into the EHR, right? They want to help
Yeah.
people. And so this gets them out of that and being able to look at you and say, they're going to take the notes for me and then I'll review them. Is that okay? When you get the patient consent, then you are actually able to look at your patient in the face and have a really good conversation. That's great for the doctor. It takes the stress off of them, and it's great for the patients. And what we found was, when the providers used it and used it well, they were 33% less time outside of their scheduled hours trying to finish those charts. And even better, 25% of what we call pajama time, which is nights and weekends, went down. So they got their lives back, their personal lives back, which was great. But also, because we were closing the chart sooner for our revenue cycle friends, we dropped our chart lag by about 35%. So things were getting closed, things were getting taken care of faster. And that was absolutely, I mean, those are great numbers and great statistics. We were very pleased with it. But there are some doctors that this did not work for. There's a thing in Epic called smart phrases where you can schedule things and it does all kinds of stuff for you, right? And the more adept you are at that, the more you can customize it just for Crystal. And some doctors have that down to a T, that it's actually slower to be able to have to talk and then read it than it is to do that. Some doctors with human scribes just really are in sync with their human scribe, and they can just look and that they know. So again, it doesn't work for them. So it's not something that works for everyone, but for those that spent the time in it, they found that it was great. But we had to remind people to use it. And we had to, really onboard them and engage them and keep them engaged, so they didn't like, oh, I'll use it on Monday, then I don't want to bother with it. To really get that, that cadence of using it and using it well. And it was a new tool. I mean, remember, this came out right after ChatGPT was going on. And so throughout the year of our pilot, Microsoft was also changing it and adapting it and making it smarter and smarter. So the people who started with the pilot, by the end, they're like, this has changed so much, and it's so much better of a product than it was when we started. Overwhelmingly, we decided to expand it throughout the whole system this year. So starting in January, we're now starting to roll it out to all of our providers that would like to use it.
Since you're not a clinician, I think one of the important questions, as also somebody who is not a clinician, I've spoken with a lot of doctors about this, and there's a kind of a tremendous amount of fear because Epic was supposed to, or not Epic, but EHR, EMR was supposed to improve everything, especially about primary care. And I think it has improved a lot. I think efficiency is up. I think doctors earn more for the hospital for sure now. But a lot of doctors feel kind of like they got the short end of the stick. And so when it comes to new technologies, they're already like in a bit of fear, right? They have, especially in primary care, a lot of doctors in their 40s are saying, I have this loan debt, I have this huge patient burden, I don't really see this light at the end of the tunnel. And then the administrators like ourselves are saying, we have this AI technology that could really help, but there's this hesitancy. Do you have any strategies for helping with that?
Yeah, I think, one of the things, we can't just put technology for technology's sake. Like DAX is cool, right? It is very cool when it works. But, you have to make sure that the doctors really get comfortable with it. And so that they don't, because nobody wants to go in, no matter what system it is, you don't want to go in front of other people and not look smart. I mean, they went to school for 12 years, for Pete's sakes. They're smart people. So, and they're very competent. But you don't want to give them a tool that makes them not feel that way. So you want to make sure that the training, and that they have support, and that there is a phone line or a text number that they can get instantaneous support, so they feel very comfortable. And to explain the why and what's in it for them and what it's going to do for them, I think is the bigger picture piece, that you have to say, this is why you want to do it, because it will make your day go faster. It will give you time back, and try to do that. The other thing we used was physician champions. There are some, physicians that are just like, this is the coolest things, and I want the new stuff. I want the new stuff. And them to be able to tell, because I'm tech girl, right? So, that's nice that you're the digital girl and you're telling me this is a new tool, but you're not a provider. You're never going to be a provider. You do not understand a provider's life. And so getting partners on that side that try it and say, yeah, look, this is really cool. Look what I can do. Look what I've saved. And get that true people that are doing the same job as you saying, this will work for you, is so much more important than anything being pushed from IT or digital over. And so those partnerships are very important.
That's really, so just to kind of re-summarize, because it's really important, it was physician partners, which, that's really an excellent way. And I know techie physicians as well, and you can see they always have the newest stuff. So that's a key one. But then again, like you said, it's kind of understanding, trying to understand their workflow, understand what the value is. But I really like the point about that knowledge, because you're right. Doctors, they do rely on their kind of confidence for patients to listen to them and accept their care. And I know in primary care, especially with gap closures, with preventive care, they really do need to rely on that expertise and that confidence in the situation. So that's really key. Do you think that, like, or I guess the question is, how did you learn that? Was it through experience that you learned how to reach out to physicians, how to identify their struggles? Because as somebody who's early in my career, right, when it comes to working with physicians, I'm still nervous when it comes to working with them.
Yeah, I think it's just a matter of having the confidence in what you're doing and
Mm.
reaching out and explaining, this is what I know. I don't know everything, but you do. Can you partner with me and help me accomplish this task? Or going to, we call them ICE chiefs, experience, they're the ones that run that department. To go, what is who should I talk to? Who would be somebody that I could partner with on your team, so that I can, try this thing or do this thing, and who would maybe be interested, and then trying to build those relationships. I think at the end of the day, the relationship game is one of the biggest pieces that you can have, is being trustworthy and showing that trust and earning the trust of people, and that does not come right away. I mean, even being a newcomer here, people are very nice, and they want to help, but they're like, oh yeah, we've tried these things before, it's not going to work, right? So you want to make sure that, well, let's, can you partner with me and let's see if we can make it work this time. And maybe if
Yeah.
we're not, it's a pilot. Sometimes it's okay for a pilot to fail. And you have to be willing to let that go too, because you can spend a lot of time trying to make a pilot work and just be stuck in pilot mode forever. And it never actually launches and it never gets anywhere. And so there's a part of a pilot you'd be like, okay, this is the stop end. If it doesn't happen by this date, or if we don't get this functionality by this time, then we have to look for another vendor or move on to a different project.
Yeah, that's important, because I agree. And especially we learn that in project management, but sometimes we forget it because we want, especially being new in the organization, I'm sure, you want things to work because your name is kind of riding on that. So I appreciate that a lot. So we've discussed the bots, we've discussed kind of the DAX Copilot. What was that third one that?
So this is something that's a little more, and it came after Chat GPT as well. But we launched a voice bot for our patient access center, and so everybody goes, "Oh yeah, I hate voice bots. It's awful, right?" And so what they're thinking about is, "Hello, you reached MUSC. Press 1 for orthopedics. Press 2 for primary care, or whatever, and it's that you're stuck in the loop, and you're like on your cell phone, and you're like, "Oh my
Yeah.
gosh, I have to check." Like, wait, no, I've got to go back to the number pad so I can push in a 3. And then you're like, yes, and it doesn't answer. Yes. But that's not what I'm talking about. I'm talking about a full natural language processing voice bot. So when you call, her name is Emily, you call and says, "Hi, I'm Emily. I'm your digital assistant. How can I help you?" And it says, "Well, I'd like to check on my appointment." Sure, no problem. They get some information because it has to go into Epic. So it has to get your name and some other key facts. It goes, "Oh, yeah, I see that you have an appointment on Tuesday, the 21st and Thursday, the 23rd. Which one would you like to talk about?" The one with Dr. Smith. Sure, no problem. That's Thursday, the 23rd at 1 p.m. Do you want to still keep that appointment? Do you want to cancel it? Do you want to reschedule it? And she can do that just speaking out. Oh yeah, and then I also have one for dermatology later in the month, and she can switch gears and also go to that. And so that is super exciting. Again, we started really small with just a couple of lines the first day, but it took a while because it's a voice bot, right? So, and it's natural language processing, which is a much that higher point of AI that we're getting into, as opposed to the bots, because now we're talking about a large language model, et cetera, and so on. And so we did find some problems because it's like, okay, what's your name? It's Crystal Broj. Oh, Broj, Broy. Like, no, 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 Broj. And she goes, "Oh, your last name is no, 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 Broj," because she's still a computer.
Yeah.
So, no, B as in boy, R as in Roger. And she's like, "So your name is B as in boy, R as," and you're just like, no, learn. It's like, okay, well, we loaded in the top 10,000 last names in South Carolina. So she learned a little bit. And then we loaded in, okay, well, what if they say as in, and we use the NATO alphabet, Alpha Bravo, blah, da, da, da. And that's great. And yes, that's one way for her to learn. But I'm in the South. So you might say B is in bourbon, and you just never know what you're going to get the next time. So we realized that even the natural language processing and the picking up of it is good, but it's not necessarily great yet. It's still learning. And so we decided after getting, only about 50% of people coming through that way and being able to confirm, we started with another identifier that would work better for people, that is easier to use. We may go back to the other one eventually. But we're also now training that to be able to reschedule appointments, which is harder than just looking up an appointment and canceling an appointment, because then you have to offer up times and understand a lot more about, do you have anything Thursday at 4 o'clock? No, not anything else at 4 o'clock time frame next week. And she has to be able to understand that and work with that. So we're training her on that now. Training her on Spanish again for our Spanish speaking friends. So that's coming out, and we're working on a chatbot that will mirror some of the things that she can do on the phone on our website.
That's really smart. So you'll have both. And then what, just for the audience, what identifier did you end up going with?
It's a standard Epic identifier. So if you work in Epic, you can tell. I don't want to just announce that over.
Right, right. So one of the ones in the within Epic, is this a proprietary technique that you've discovered, is what you're saying?
Yeah. Well, it's Epic. It depends on how you have Epic set up and what things you allow to go through the security.
Oh, very impressive, very impressive. So this is you can't just do this on your own. You have to collaborate with the Epic team, with the data team. It's not something that you can just establish by creating an innovation team and saying, here you go.
No, we really had to partner. And that was a very interesting challenge, because a lot of these innovations, like I've talked about, we started small and then we opened it, like the Emily, the voice bot. We started with 4 lines and then we expanded and then we expanded. And so IT is used to having things very waterfall, right? Because their teams have been doing Epic installs or Epic updates or other big system updates. So they're very big and very grown up. So they're very established. So they know that there's going to be a go live date on June 30th. So 30 days before that, they have to finish testing and get the environment ready for the move and talk to everybody. And then 30 days before that, they're looking at the release notes, and they know exactly what needs to happen with incredible precision. A vendor who's doing a new technology is very agile. And so you may be doing something and this piece doesn't work. So then they're like, oh no, the API that we wanted to do the confirm or the cancel or whatever, that's not working correct. We need a new API. And so that means then you have to go back to, they thought they're done with their piece. They set up the API for you. Done. No. We have to try something else. Or we need a report to validate this. Or now we're moving on to the next 5 sites or whatever. So we need a download of those 5 sites. So it's sort of the gift that keeps on giving. Smaller, like just I need an API guy for like 2 hours this week and then to validate for an hour next week. But really, really hard to staff. And trying to partner with IT and get a cadence going so that they would understand what we're going to need and how that can fit in with the rest of their department has been something that over the past 2 years we worked on partnering with. And I'm so thankful for our IT leadership that they have had the grace to put up with some of the changes that and the disruption that we bring to their department, just by the sake of the innovations that we're doing, and having all these different vendors that we're working on. They're basically hitting the same resources, because basically it's Epic Cadence, it's the API teams, it's the reporting teams, that we need certain things from at various times throughout the year. But it's sort of much more sporadic. It's not a scheduled thing.
Yeah, and it's important. I appreciate you kind of sharing insight into the problems as well, because there are so many different things, like you said, that kind of how patients are going to identify themselves on the phone. And like you're saying, it's not something that you can just solve by coming up with an easy alternative. And none of these things really are. You have to talk with physicians. You have to talk with the patients. So it's all really important. Again, thank you so much for coming on, Crystal. I really appreciate your time, and I hope we can have you back on again.
I would love it. Thank you so much.